What are the diagnosis and treatment of bladder cancer? Diagnosing bladder cancer. Tests and procedure used to diagnose bladder cancer may include cystoscopy. To perform cystoscopy, your doctor insert a small narrow tube through the urethra. The cystoscope has a lens that see the inside of your urethra and bladder to examine the structure per sign and symptom of biopsy. During cystoscopy, your doctor may pass a lot of tool through the scope and into your bladder to collect a cell sample for testing. This procedure is sometimes called transurethral resection of bladder tumor, which can also be used to treat bladder cancer. Urine cystology. A sample of your urine is analyzed under the microscope to check for cancer cell in procedure called urine cytology. Imaging test. Imaging tests such as computerized tomography, urogram, or retrograde pallogram allow your doctor to examine the structure of your urinary tract. During a CT scan urogram, a contrast dye injected into your vein and your hand eventually flow into your kidney, ureter, and bladder. X-ray images taken during the test provide a detailed view of your urinary tract and help your doctor identify any areas that might be cancerous. Retrograde pyelogram is an X-ray exam used to get a detailed look at the upper urinary tract. During this test, your doctor thread a thin tube catheter through your urethra and enter into your bladder to inject a contrast dye into your ureters. Then the dye flow into your kidney while X-ray images are captured, determining the extent of the cancer. After confirming that you have bladder cancer, your doctor may recommend additional tests to determine whether your cancer has spread to your lymph node or other areas of your body. The tests may include CT scan, MRI, magnetic resonance imaging, bone scan, chest X-ray. Your doctor uses information from these procedures to assign your cancer a stage. The stage of bladder cancer are indicated by Roman numerals ranging from 0 to 4. The lowest stage indicate a cancer that is confined to the inner layer of the bladder and hasn't grown to affect the muscular bladder wall. The highest stage, which is level 4, indicate the cancer has spread to the lymph node or other organ in the distant area of the body. The cancer staging system continues to evolve and is becoming more complex as doctors improve cancer diagnosis and treatment. Your doctor uses your cancer stage to select the treatment that are right for you. Bladder cancer grade. Low grade bladder tumor. This type of tumor has cells that are closer in appearance and organization to normal cell. A low-grade tumor usually grows more slowly and is less likely to invade the muscular wall of the bladder than a high-grade tumor. High-grade bladder tumor. This type of tumor has cells that are abnormal looking and that lack any resemblance to normal appearing tissue. A high-grade tumor tends to grow more aggressively than a low-grade tumor and may be more likely to spread to muscular wall of the bladder and other tissue organ. What are the treatment? Treatment option for bladder cancer depend upon number of factors including the type of cancer, grade of the cancer and stage of the cancer, which are taken into consideration along with your overall health and your treatment preferences. Bladder cancer treatment may include surgery to remove a cancer tissue, chemotherapy in the bladder, intravesical chemotherapy to treat tumors that are confined to the lining of the bladder but have high risk of recurrence or progression to higher stages. Reconstruction to create a new way of urine to exit the body after bladder removal. Chemotherapy for the whole body, systemic chemotherapy to increase the chances for a cure in a person having surgery to remove the bladder or a primary treatment in case where surgery is not an option. Radiation therapy to destroy the cancer cell open as a primary treatment in a cases where surgery is not an option. Immunotherapy to trigger the body immune system to fight the cancer cell either the bladder or throughout the body. Bladder cancer surgery. Transurethral resection of the bladder tumor is a produce such is a procedure to remove bladder cancer confined to the inner layer of the bladder, those which are not yet muscle invasive cancer. During the procedure, a surgeon passes a small wire loop through the cytoscope and into the bladder. The wire loop burns away cancer cell using an electric current. Alternatively, a high energy laser may be used to destroy the cancer cell. Cystectomy. Cystectomy is a surgery to remove all part of the bladder. During a partial cystectomy, your surgeon removes only a portion of the bladder that contains a single cancerous tumor. Partial cystectomy may only be an option if a cancer is limited to one area of the bladder that can easily be removed without harming bladder function. Chemotherapy. Chemotherapy uses drug to kill the cancerous cell. Chemotherapy treatment for the bladder cancer usually involves two or more chemotherapy drugs used in a combination. Chemotherapy drug can be given through a vein in your arm intravenously. Through tube pass through your urethra directly into the bladder. Chemotherapy is frequently used before removal surgery to increase the chances of curing the cancer. Chemotherapy may also be used to kill the cancer cell and might remain after the surgery. Chemotherapy is sometimes combined with radiation therapy in very select cases as an alternative to surgery. Intravesical chemotherapy may also be primary treatment for the superficial bladder cancer, where the cancer cell affect only the lining of the bladder and not deeper muscle tissue, or sometimes immunotherapy may be administered or as intravesical therapy for superficial bladder cancer. Radiation therapy is another option. Radiation therapy uses high energy beams aimed at your cancer to destroy the cancer cell. Radiation therapy for bladder cancer usually is delivered from a machine that moves around your body, directing the energy beam to precise point. In select cases, radiation therapy is sometimes combined with chemotherapy as an alternative to surgery or when the surgery is not an option. Immunotherapy. Immunotherapy, also called biological therapy, work by signaling your body immune system to help fight cancer cell. Immunotherapy for bladder cancer often is administered through the urethra and directly into the bladder. One such immunotherapy drug used to treat the bladder cancer is Bacillus calmette-guerin, which is a vaccine used to protect against tuberculosis. Another immunotherapy drug is synthetic version of interferon, which is a protein your immune system make to help fight infectious cell. Bladder preservation. Using three-pronged treatment approach may preserve the bladder in a certain cases of muscle invasive disease known as trimodality therapy. The treatment approach include TURBT chemotherapy and radiation therapy. First, your surgeon